Good morning, everybody. I'm very pleased to be here at St George Hospital with the Minister for Health, Minister Hazzard, with our Chief Medical Officer, Dr Kerry Chant, and also Susan Pearce from the Department of Health. And I wanted to give a special shout out to Susan. Her and her team have made sure that New South Wales has remained on track with our vaccination rollout. And it's very exciting today to be able to provide the AstraZeneca vaccine also to key frontline workers that we've been vaccinating here in week 3. We said in New South Wales that we hoped to vaccinate around 35,000 people in the first 3 weeks, and we'll be getting very close to that number. I'm very pleased to say that as at last night, we'd already vaccinated 27,000 people in New South Wales through the New South Wales health system. That does not, and can I make this clear, that does not include those who've been vaccinated through the federal government's aged care providers. So as far as the New South Wales health situation is concerned, as at last night we've done 70,000 people, and of course today with St George and Hornsby coming on board, it does allow us to increase our capacity of how many people are able to get the jab on a daily basis. I also wanted to make this point very clear. New South Wales is very pleased to be able to be open and transparent as to how many people get the vaccine. Can I make it very clear that New South Wales was not one of those states that objected to figures being provided. We've also always believed during the pandemic it's best to be upfront with our public, and at any time the federal government or anybody else wants access to those figures, we're happy to provide them. But I'm extremely pleased with how it's going, and today Minister Hazzard, Dr Chant and I will be getting the AstraZeneca vaccine. And it's important to remind the people of New South Wales that most of you will be offered the AstraZeneca vaccine. Now, the efficacy or how effective the AstraZeneca and Pfizer vaccines are has been shown to be pretty much the same. They're both as effective as each other, and what is important is for us to be able to vaccinate as many people as possible as soon as possible, because we know that when the vast majority of the population is vaccinated, that increases our ability to not only ease restrictions, but to start thinking beyond our national borders and what it means for international travel. We know the biggest hindrance to our economic development and growth in the next little while will be our ability to open up to the rest of the world, and that is a really important prospect for New South Wales. We've always believed that it's in our state's interest, in our nation's interest, to make sure not only that we keep the virus at bay, but also that we have an eye on jobs in the future, and that's certainly our thinking moving forward. I also wanted to stress that I've made clear to the federal government that at any time, in addition to the GP network, where Minister Hazzard will talk more about that, but the GP network is where most people will be asked at the right time to contact their GP and get the vaccine. We've also offered to remain standing our 100 hubs around the state, which are provided by New South Wales Health. Previously, the vaccine would have been rolled out just through the GP network, but we are keen to support the federal government's efforts because we want our citizens to get vaccinated as soon as possible. If other states are going a bit more slowly, that's a matter for them, but as far as New South Wales is concerned, we want to get as many doses out as possible. And in relation to the doses, can I say that we're really pleased to be able to receive, and have received, some of the new syringes that let us get 6 doses out of a vial instead of 5. If you look at the figures that the federal government has provided, they say that New South Wales has given out 74% of the doses available to us. But if you counted 5 vials, 5 doses instead of 6, it would mean that we were closer to 90% of getting the vaccine out. But now that those new syringes have been provided to New South Wales Health, it means we can get 6 doses out of 1 vial, sorry to get so technical, which means we'll aim to have closer to 90% of the doses getting out in the week that we receive them, which is our intention. And that's certainly something we're looking forward to. So we appreciate that every nation around the world always has challenges when you're doing max vaccinations. But what I can say about New South Wales is our population has been absolutely positive about it so far. I asked Susan Pearce from New South Wales Health today what the rates were like of people coming forward, and she said there were virtually no-shows, there were very few for obvious personal reasons, but the vast majority of people were very enthusiastic, and the response has been very positive to the vaccine, and most people obviously until this time have received the Pfizer vaccine. And it's also interesting to note, if I can make this point clear, that if you have the Pfizer vaccine, you wait 3 weeks before your second dose. If you have the AstraZeneca vaccine, which is the one I'll be getting today, you wait 12 weeks before you get your second dose, and that means you've completed your dose. So I'll get one jab today and then come back for another one in 12 weeks' time, and that means I've completed being vaccinated from COVID. I'll leave it there. Ask Dr. Chant to talk about some of the medical issues around the vaccine and what it means. Minister Hazzard will then talk about what the public can expect to do in the next few weeks regarding GPs, and then we'll be pleased to take any of your questions.
Thank you, Maria. So just to indicate that we have no locally acquired cases of COVID in the 24 hours to 8 p.m. last night. There were 5 new cases were acquired overseas, bringing the total number of cases in New South Wales since the beginning of the pandemic to 5,031. Testing numbers were 15,534. Again, that's pleasing to see that bump up that we do see in midweek. So thank you very much to the population for continuing to come out and get testing. In terms of the vaccines, we're very privileged in Australia to have access to vaccines and to be rolling out vaccines at a time when we have no community transmission. We therefore can, whilst we are trying to do it as rapidly as possible, we can take our time to make sure that that's rolled out methodically. And today we, as the Premier indicated, myself and Minister Hazzard and the Premier are going to be receiving the AstraZeneca, and that commences a sort of 1B phase rollout. And AstraZeneca will be in much larger quantities than the Pfizer vaccine, and hence the majority of the population will have that vaccine offered to them. And I would like to assure the community that our regulator has assessed the safety and efficacy of both vaccines, the Pfizer and the AstraZeneca, and have registered them. And they are safe and effective vaccines, and the community should have confidence when it's your turn in coming forward to be vaccinated.
I'd just like to start by reminding everybody that this is week 3 of the Pfizer vaccine rollout, and of course it's occurring through 3 of our hospitals, being RPA, Westmead and Liverpool. And those people who are being vaccinated are principally our quarantine staff, up to about 10,000 odd people who work and keep us all safe through the hotel quarantine system. As we progress, we're also looking after our frontline health staff, so for those from emergency departments, ICUs and so on. But what we're now opening today is the AstraZeneca hubs, and these hospitals are being, at the moment, St George and Hornsby, are the start of the AstraZeneca rollout for the same groups of people that will principally be moving into health staff. But as the Premier has said, we will, moving forward, be looking at expanding our opportunities in our hospitals to the public. But look, first and foremost, in the next few weeks, end of March, early April, we expect that the federal government will roll out the AstraZeneca vaccine to the GPs and make the announcement of the GPs who will have it. I understand that there's somewhere between 1,300 and 1,600 GPs in New South Wales who will actually have the opportunity to vaccinate some of their patients. Obviously it's dependent upon the amount of AstraZeneca that the federal government can access. But the good news for all of us is that it's expected that there'll be very ample supplies coming from CSL in Victoria for AstraZeneca. So effectively AstraZeneca will be rolling over the top of the availability of the Pfizer vaccine. Eventually all of us, and the Premier said today, the Premier, myself and the Chief Health Officer will all be receiving the AstraZeneca vaccine. We have absolute confidence in that vaccine and are all looking forward to having that vaccine. But I would just strongly suggest to the public that don't necessarily make calls to your GPs. I think the GPs are all pretty busy with their patients anyway, because at this stage they won't be able to tell you when they can actually start the specifics of the rollout. But listen to the messages from the federal government, and in the next week or 2 weeks the federal government will be making those announcements, and the GPs will then know who is actually getting the vaccine and when they're getting it. And at that point, that's when perhaps you could talk to your GPs, but otherwise your poor GPs will be run off their feet answering questions about issues at this stage they're not 100% certain of. The primary rollout to the public, of course, will be AstraZeneca, and it will be through GPs. But, as the Premier has said, New South Wales is and has made the offer to the federal government that we will step up and assist, if necessary, through our hospital systems. And I want to thank all the health staff. We've got Dr. Chant here, and of course the Deputy Secretary, but we see every day, and the Premier sees when she's in the hospitals, just how much work goes on with our frontline health staff. So thank you to each and every one of the health staff in our hospitals who will be actually taking part in what is an historic rollout in this 1 in 100 year pandemic, making sure that the citizens of New South Wales are vaccinated as soon as possible through a joint effort of the federal government and the New South Wales government. Thank you.
Can you just clarify, Dr. Chan, numbers of vaccine on the first day today? I seem to hear two separate figures. How many people up to last night or this morning have been vaccinated? And what proportion of the vaccines that we've received from the federal government have we used, either on the 6 doses per trial or the 5 doses per trial?
So New South Wales is on track to get to that 35,000 target that we'd indicated in that first 3 weeks. So by the end of the week, we will have got to that target. The issue that we discussed previously was the fact that the vaccine, because we did not have access to the specialised low dose volume dosing equipment, we could not get feasibly 6 doses out of it. The Commonwealth Government has now procured those. You can imagine that there is a worldwide shortage, and so we very much appreciate the efforts of the Commonwealth in securing those for the nation, and that will assist us get those 6 doses. So some of the numbers that are running around are because of that disparity between the 6 doses were contingent on the use of the low dose syringes to draw it up, and we're now in possession of that, so we will adjust our figures accordingly.
On the 5 doses by the biometric, what proportion of Pfizer vaccine administered Premier have we?
Yeah, those figures were released by the Commonwealth Government, and I think New South Wales was sitting at around 74%. But we're still on track. We're still on track. We provide all of our information to the Commonwealth, and it's up to them as to what they distribute. So we're completely transparent. If the 6 versus 5 issue wasn't around, we would have dispensed 90% of the vaccines.
Sorry, Sonia, you said that New South Wales was one of the states that didn't want the percentage of vaccines delivered versus administered release. So what percentage of vaccines have we administered based on what has been delivered?
I'm not sure what you're asking, James, but 90%. If you're talking about our calculations, we've dispensed 90% of the doses we've received. That's overall to date.
Just on targets, for the first 3 weeks, 35,000. Do we have targets now for the next 4 weeks?
We're still waiting for confirmation on exactly how many doses we're going to get beyond that point. So we'll be able to tell you once we know. But we also have to remember that we need to give a second dose to those who got the vaccine in the first week. So those who got a jab in week 1 will have to come back in week 4 and get a second dose. So as soon as we have confirmation of those numbers, we'll be able to share it. We just don't have confirmation yet. And once we do, we'll be able to share that with you.
So on that, Premier, has the flow of information from the federal government improved at all about aged care and about...
Can I say, look, everyone is trying their hardest, but I will say that there's also been a disruption of supply chains around the world, and so obviously what they had anticipated arriving at certain times may have been altered. The good news is that in the near future, I'm advised that AstraZeneca will be supplied or manufactured locally, so therefore the supply issues won't be an issue then. What is important for us is for New South Wales to make sure we have the systems in place. I don't know if any other states are doing online bookings or have as many hubs as we do, but we're making sure we can scale up very quickly, and that's our aim, because if you're not ready to scale up, it's a bit like rolling out the QR codes or rolling out anything else. You have to put the systems in place to make sure you can scale up. And I appreciate, New South Wales Health is advanced in many areas, as is the government, and some states have a relatively lower percentage of what they've been able to get out to their communities. But we're really keen, because we know vaccinating as many people as possible allows us to consider easing of restrictions, makes the population safer, makes the community safer, and also, of course, allows us to think about international travel beyond what's happening now.
Overnight we saw the Health Minister, Greg Hunt, hospitalised. The anti-vaxxers jumped on that, saying it was connected to his...
No, I've been in contact with him. I was in contact with him to wish him well, and he's kindly sent me back a message to say it had nothing to do with the vaccine. Yeah.
Are you confident that just a message back to them saying that about...
If I wasn't confident, I wouldn't be getting the jab today.
Can you tell us, it's 20 odd minutes away, are you a little nervous? Are you
No,
scared of
I don't mind injections, so I'm quite okay.
So the APRA and the National Medical Boards have come out and they basically released a warning to doctors and nurses who may share anti-vaxxers, and obviously this is relevant overnight. How concerned are you about this? Is this a real problem? And what sort of regulatory action should be taken against people?
Well, at this stage, I'm not concerned at all because admittedly, the cohort of people we've invited to take the vaccine have been very enthusiastic. So I'm actually feeling as time goes on, and certainly the feedback we're getting through Service New South Wales is that as time is going on, more people are feeling more confident about getting the vaccine. So the situation's actually improving, not declining. And I think as the weeks go on and people understand what this means for us as a community, and interestingly, some people through our feedback mechanisms are giving us feedback to say, I'm happy to get the vaccine, but I'm worried not enough other people will. So it's actually becoming now an issue where we know we're not just getting the vaccine for ourselves, we're actually getting it for those around us and for the broader community, because we can't move forward as a society in terms of easing restrictions or thinking about the future unless the vast majority of people get vaccinated. And we know now from what the federal government has said that you know, in some phases and stages may take longer than what was anticipated, but New South Wales is ready to assist. We're ready with the 99 regional sites we have. Some of those sites kick in from the 15th of March, which is next Monday. But obviously we've also now, as at today, got 5 really good hubs up, and on average they're managing to vaccinate a person a minute, so around 60 people a minute at each of those 5 hubs. So that's quite a few people a day, which is really exciting, and we have the ability then to scale up as well once we get extra doses.
So
but
yeah, so if doctors and nurses do express misleading views about vaccinations online, do you think they should be stripped of their practice?
Yeah, Lucy, I'm not interested in kind of dealing with hypotheticals, but we've not had to counter that in New South Wales. Our medical staff have been outstanding during the entire process of the pandemic. I want to take the opportunity to thank them again, especially those that work at St George Hospital, for the wonderful work they do. And it's just been a very positive experience. And as I said, as time goes on, we're feeling confidence growing, not receding as far as the vaccine's concerned.
Low dead space being...
I'm sorry?
Can you talk us through the logistics of rolling the vaccine out to regional areas, and who are these the hub and spoke model? Is that which hub by a road or there, and how long you take this?
Well, that's why that's a challenge for us, and Susan Pearce has done an unbelievable job and given me a number of briefings on how it will work. But obviously the Pfizer vaccine is a bit more complicated because you have to keep it at minus 78 degrees Celsius. The AstraZeneca has less complication. So what we've done is made sure that we have refrigerators in many of those hubs, but the ability to then get the vaccine out to 90 odd spokes across the state. So that will start happening from Monday. And remember, this complements the GP network. So a lot of our regional cities and towns will have GPs there as well. So once it's offered to the broader public, there'll be the GP network and potentially all of the New South Wales government hubs as well to provide the vaccine.
And you're happy with the rollout and the numbers that are happening so far. We had an update from last week earlier. But Australia's rollout as a whole is drastically behind schedule. We're halfway through March, we've only, as a nation, gone through 3% or even less of that. The PM wouldn't say what the issues were. Is this a supply issue from the Commonwealth? You said that there's still no information coming about that, or is it the states and their problem in their speed of the rollout?
Well, that's why we've extended our offer to the federal government to say we're happy to keep standing up our 99 odd hubs to allow the broader public to potentially access them in addition to the GP network. So that's why we're saying what we're saying. So obviously it will still take us some weeks to complete all of the health workers, all of the people in so-called 1A and 1B. That will take some more weeks. But then beyond that, when we start looking at the different cohorts and the GP network comes online, New South Wales is ready and willing to assist in the rollout, because otherwise I don't want us to have to wait extra months as a state to be able to move forward, and I don't want anyone's health and safety compromised. So if we do have the ability to speed things along, we want to take that opportunity, and certainly that's why we've been very vigilant in getting our systems in place, in making sure we have those online booking systems to make the experience very easy. And of course, under these circumstances, it's not always easy to give advice or information to the states, but all I can say as a plea is that the more information we have, the better we can plan and the better we can expend all of our doses. And I'm really thrilled that health, you know, if you look at the number of doses and the percentage we've been able to get out the door very quickly, it's been incredible. I didn't think we'd be doing so well so early on. Full credit to New South Wales Health.
So just on GP network, not everybody has a local GP that they go to regularly. How are you going to engage with those people? Is that where the hubs come into play?
Well, that's the challenge, and that, you know, the federal government is responsible for the rollout, and that's a challenge that's something for them to advise us on. No, but that's why we have made the offer to say that we want to stand up our hospitals and our hubs to the extent we can. Of course, we don't want to put increasing imposition on our health system, because health has been through a lot the last 12, 18 months already. But it stands to reason that GP networks may have, again, depending on how many GPs take up the opportunity, there may be parts of the community where there isn't sufficient number of GPs to carry that demand, which is why we will continue to offer and consider extending our 99 hubs to the broader community.
Has the federal government accepted that?
Was that a good or a bad comment? I didn't hear.
Has the federal government accepted your offer of using your existing?
The federal government, without speaking out of turn, I did raise this at National Cabinet, and it was warmly received. It wasn't declined, and in fact I've even spoken to the Treasurer to say he should go and renegotiate the health agreement if we do more. We're happy to do more if we can, and we'd like that to be renegotiated in a bilateral way. We know that every state's at a different level, but if I can be so bold as to say that if New South Wales is poised to be able to move more quickly than other states, I would like to see us do that. I don't want us held back, because holding us back means society can't function as well as we could, and that's important to us.
To clarify that, Premier,
I'll get round to everybody. Yep.
To clarify that, though, your role, the state's role, officially finishes at the end of 1B.
It does. It does.
That's when all those hospitals
That's
are
right.
empty and redundant.
That's right. Well,
It could be used.
Yeah. Well, that's the point. At the end of 1B, that's the end of the state government's responsibility, and that's why I've made the offer, which has been well received, that we would like the option of being able to continue those hubs. But again, we need to make sure we don't impose too heavily on our health system. It takes a lot of resources, and we'll be having those discussions this week with our health officials. I would like to see all of those 99 sites remain open to some extent for people who want to receive the vaccine. That will certainly provide some support to the GP network as well. And it will also ensure that we save months, because otherwise it's likely to take months longer than what was anticipated to get the rollout to the number of people that we hope would receive it.
Premier, when do your predictions suggest it's likely that the hospital hubs would have finished their job with 1A and 1B? I guess when would that offer?
Yeah, I asked Susan that question. It was around another 4 weeks, about Yeah. So potentially we had several months for that to occur, but there could be a situation where, depending on when the GP network is standing up and ready, whether we complement those during that time as well, and we're able to bring forward categories. So they're the conversations and the briefings that we've been engaged with. In fact, we've started getting that information, and that will be made clearer to us once we know exactly how many doses we're getting in the weeks beyond next week, frankly.
And the numbers that you're likely to be doing at these two hubs at Hornsby and St George, it's on a booking system. So how many bookings are you accepting every day?
Oh, we're getting around 2,000, 2,200 in total, but sometimes more people show up than what the booking is. But in essence, it's been a very streamlined system, and on average, I'm advised there's one jab a minute at each of those 5 hubs. There will be at each of those 5 hubs. So whereas yesterday we did around, I think, 2,300 in one day, we're likely to double that in the days moving forward.
Is it the state's dragging? And then Professor Murphy today said, look, they're not going to hit the 4 million target by the end of April, but concede it. They're still hoping for October, the end game. Is it and we're flying, doing 35,000 in 3 weeks. Are the other states dragging the chain?
Well,
what is the issue?
I can't answer that question because I don't know the answer. What I do know is how many doses we're given and what we do with that, and how we roll out the system and how we can scale up. So I'm certainly in a very confident position in terms of our capacity as a state to get the vaccine out to the public as soon as we can. But that depends on the information I get on how many doses we get and when that's likely to be. But I am confident that once AstraZeneca is manufactured in Australia, that those supply issues won't exist and there'll be far more certainty in providing that mass scale-up of vaccination.
Have you been in touch with other premiers about these issues that we're having at the moment with vaccination? Have you been in touch with them about these issues of the information coming from the federal government? With how many doses are...
Oh, look, those issues have been discussed at my level at National Cabinet, but I know Minister Hazzard and his colleagues have had extensive conversations as well. And, you know, the states are very much on the same page on a number of issues, but at the same time, New South Wales doesn't want to fall behind if we can actually provide opportunities for our citizens to get the vaccine in a more efficient and sooner way if we can.
Premier, Tasmania has said no thanks to the international student quarantine proposal. Is there an alternative that's on the table? Is there another location that you're considering?
We're not considering another location at this stage, but we're certainly thinking about creative ways in which we can safely manage Australians coming home, but also safely manage vital skilled workers and also international students that provide so much support to our economy. And it stands to reason, if you look at the economic numbers, and I think confidence numbers on consumer spending are coming out today as well, if they haven't already come out. I think they have earlier this morning. New South Wales is leading the nation or close to leading the nation on those figures. I think what's important is to remember that our economic growth is really dependent on our ability to keep the economy open and to keep moving forward. And we need to be able to do that. And for New South Wales, Sydney and Melbourne in particular have been the greatest hit by the COVID economic impact. The regions, ironically, are doing extremely well at the moment. But Sydney and Melbourne have borne the full brunt of COVID, and we need to be creative in how we can support the economies within those CBDs because they contribute in such a substantial way to our nation's economy. And that's why it's important for New South Wales to push the boundaries literally when it comes to considering skilled labour and also international students.
That's going to outrage a lot of stranded Australians trapped overseas.
Oh no, I'm not suggesting for a second. I'm not suggesting for a second that others jump the queue. But what I'm suggesting is that if every state did their bit in welcoming home Australians, we'd then finish that task sooner and then be able to move forward in terms of the other categories. But when, you know, Victoria's been out of action, I don't think they're still not taking anybody in, and the other states are certainly not doing the same rates as New South Wales. And I guess that causes always a bit of frustration for us because the sooner all the states chip in to do their bit, it means we get Aussies home more quickly. And I don't think any Aussies abroad would be complaining about New South Wales. I think a lot of them are grateful that we've been doing what we've been doing. A lot of them have been waiting months and months to get on a flight. A lot of them are experiencing enormous hardship, and that's why New South Wales has had a compassionate approach to that.
In terms of economic impact,
Clinton hasn't asked me.
In terms of economic impact of the CBD, trains are starting to get quite crowded. Are we getting closer to removing the green dots to encourage people?
Well, they're all the issues that our health experts are looking at, and we're getting close to around 60% capacity now on our public transport network compared to pre-COVID. So certainly the trends are moving in the positive direction, and what's holding a lot of people back are those green dots. So we are looking at those issues.
Deputy Chair, can I just ask, big day for you. You're about to get the vaccine and your New South Wales Women of the Year. How are you feeling?
I'm very happy that we've got access to vaccines, and I think one of the key issues is that we are in an international environment where we have the privilege of having no community transmission across Australia, and I say that at this point in time because we continually live at threat of the incursion events, introductions of COVID into the community through our borders. But we are very privileged. We therefore have to stand in line for the vaccines. The Commonwealth Government have procured vaccines, the AstraZeneca and the Pfizer, and to some extent that has been the initial constraint that we've had. We always know things take time to scale up, but again, having a domestic manufacturer capacity in the AstraZeneca vaccine, onshore manufacture of a secure supply of vaccine, we are in a privileged space. So I just want to be very positive on Women's Day to say that it is a privilege to be here to receive my vaccine today. And please know that everyone is working as hard as possible to roll out the vaccines both at a state and a Commonwealth level, and we're aiming to get the community protected from COVID, but please still follow COVID safe practices and come out and get tested.
Last few questions, please.
Can I ask you just about the the events that we've seen this week, in particular overseas, particularly the Meghan and Harry interview, there has been a view of some in your ministry, Minister King, that the events of this week and Harry and Meghan leaving the monarchy means that it's time for Australia to become a republic. Do you share Minister King's view?
Oh, to be honest, I haven't had time to watch that, and I haven't had time to think about that.
You're aware of what Meghan and Harry have done in
Yeah, I don't really want to comment on that, to be honest.
In terms of GP training, which I understand is being paid by the federal government, do you know how many of our 1,300 to 1,600
Where's Minister Hazard? So,
I'm sorry, what was the question?
training?
GP network.
Oh, yeah. We don't have those figures yet, but we do know that, look, many of the GPs were used to many of our GPs have actually used multi-dose vials in the past with, I think, MERS and swine flu, yes, thank you. And I think what we're now seeing is that they've been asked to go and complete a module, and they should. I mean, even if they've done one quite some time ago, they should be updating themselves. But I think the real issue for the GPs is simply to know how much vaccine they're going to get and when they can kick it off so they can talk to their patients. And look, it's a challenge because, as Dr. Chance just said, the federal government's done a first-class job of getting vaccine at a time when many other jurisdictions didn't have that capacity, and now we just have to work through it.
Last question, please.
You mentioned, Mr. Hazard, 1,300 to 1,600. Is that the number of individual GPs, or is that the number of GP clinics?
That's GP practices.
And how many GP practices will not be part of the rollout in New South Wales?
Well, I don't think it's that definitive because the federal government is saying that they'll still look at some of the balance, so it's not that clear at this point. But I think we've got about I think there'd be about another 1,000 or so that would have to be looked at, but it's not that clear. And some practices, of course, didn't actually apply, didn't have an interest in doing it. So I think we've just got to give the federal government a little bit of time to work through that.
Thank you, everybody. Vaccine time.
Minister Hazard, this is the time that we have an Australian head of state. Do you think that the events of last week have fast-forwarded that conversation?
James, I admire your enthusiasm, but I'm here to have an AstraZeneca vaccination, and right now I'd rather do that than talk about matters of overseas jurisdictions. But thank you for your interest.
Thanks, everybody. We've got to get
If I could just ask.
Is it a different question?
Not on.
It's been talked about for weeks. When are we going to get some certainty around a vaccine passport?
I know the federal government has a plan for that, and we are awaiting details. But with 4 million people in New South Wales on the Service New South Wales Act, we're keen to assist in that process. So Minister Dominello has been working with his counterparts closely, and as soon as we have information on what the federal government's intending to do, we will then work our systems according to that.
Thank you all.
Thank you.
With your award. I know that you didn't look like you were that happy.
I think, as you know, that there's always a team of great people supporting any individual, and that's why I always feel in those situations a little humble, because I know my colleague Susan Pearce, my whole of government colleagues, the Secretary Elizabeth Koff, the CEs of the districts, they've always been there at unearthly, ungodly hours to take those calls and solve problems at a time when we didn't have a clear playbook. So I just want to acknowledge that it's really very much a team effort and a whole of government effort. So that's probably, if I was showing anything, that was probably my feeling.
Dr. Chan, is there any better way for a Chief Health Officer to celebrate such an award than to receive a needle in a hospital?
No, I'm absolutely pleased we've got vaccines, and I just want it rolled out as quickly and smoothly as we can. So thank you very much.
Congratulations.
Thanks, guys. Thank you.
Oh, that's right. Your button, the full camera. Yeah, that was it. Thank you, though. I believe that.